in the health sector. A couple of months ago, that was in April, we signed as the Netherlands government a letter of intent with the county government of Kisumu to extend and to strengthen the bilateral relationship between the Netherlands and between the county of Kisumu. That will be in various sectors. That will be in the sector of logistics. That will be in the sector of agriculture. That will be in other sectors, but it will certainly as well in the sector of health, where we have already a strong footprint together with Farm Access in the collaboration in the county of Kisumu. So after we signed in April last year that letter of intent between the Netherlands and the county of Kisumu, we really felt we had to come back with a huge delegation. And that's what we are doing this week. We started in Nairobi, but we came with that big delegation here in Kisumu. Delegation of Dutch companies working in healthcare, Dutch organizations, the Dutch government, as well as Dutch innovation and research institutions. What we're going to do today, we started this morning with a presentation from Dr. Ganda, the incoming Minister of Health, and with Dr. Spronk, a colleague from our Ministry of Foreign Affairs in the Netherlands, about healthcare, about how we can collaborate jointly in making sure that everybody in Kisumu County has access to health, and to see what kind of innovations, what kind of public-private partnerships we have to build together to make that happen, and to work together with the county government of Kisumu. After this session, we will continue to debate, to discuss in detail, and to see how we can link Dutch companies, Dutch organizations, together with companies, with organizations here in Kisumu, to see how we can jointly address some of those challenges. Later on today, we will visit some of the hospitals and work together, and for sure we will come back and will continue the collaboration together with the county government of Kisumu. Thank you.
I don't need to add anything. I think it's important that what Jory said, and I have my Minister for Health here, Dr. Ganda, and his team, who can also brief you. But what he says is very important. Government is there to facilitate development, not necessarily to provide development themselves. Of course, like we do, but that is not enough. That's why we talk of private partnerships, private-public partnerships, joint venture, and so on. And very recently, Dr. Ganda went to the Netherlands, leading a team from the health system in Kisumu to go and discuss with the Dutch government various ways by which we have been collaborating, and we should collaborating, and we shall collaborate. I followed with my minister, Solomon Orimba, and his chief officer to the Netherlands to look at ways and means by which we collaborate in water resources development, where, you know, the Netherlands, being a country which is 0 below sea level, are very well versed in how to deal with water resources. So those two visits, I think, preceded what we have today. Not that they were the precursor of this, but I think it's good that we went, and it's good that we now have a big delegation of the Netherlands to discuss with us and to see Kisumu and see our field facilities and talk with our people and our leaders in the county government about what we can do together. This is very important to us, and we're grateful to the Netherlands government, the Dutch government, and our embassy in Amsterdam, or for that matter, The Hague, for being always ready to work with Kenyan delegations going to the Netherlands, and also to encourage this kind of interaction relationship between the Kenyan government and the Dutch government.
Thank you. I think His Excellency has already mentioned, Kisumu is on a transformative agenda. We want to transform the way health system is run in Kisumu so that our people live longer and healthier lives. And to be able to do that, we need a lot of investments, as the ambassador and as the governor has already spoken. And so we, apart from the funding that we get from the government, from our taxes, we need other funding coming in from the private sector and from partners to be able to help us. You also need to collaborate with them because they are way ahead of us in terms of development. And so there's technology transfer and information transfer and sharing of knowledge between countries and counties. Now, Kisumu has had a special arrangement, a special partnership with the Dutch government through His Excellency the Governor. Our collaboration has been strong, and that is where Marwa came from. We got a lot of technical support from the Dutch embassy through Farm Access, for us to be able to build a social health insurance scheme that is piloted in Kisumu, and we are going to be spreading it out in the next 5 years, so that at least 70% of our people in Kisumu are insured and can be able to access healthcare. We are also going to be working with them to see how our primary healthcare system can be strengthened. We realize that without digital transformation, it becomes very difficult for you to be able to make informed decisions without correct data. Penetration of digital infrastructure in Kenya is very high, and that is why everyone, including my grandmother, has a mobile phone, and she's able to receive M-Pesa and know how much money has been received. So how do we take advantage of that to be able to improve our health indicators? Dutch have a strong digital experience in digital infrastructure. I visited Netherlands a few months ago to be able to learn what they are doing, and we've seen that there are very many things that they have done in terms of their digital space that we can learn from, and that is why the delegation has come here to be able to work with us, to be able to reach where they are, and to be able to innovate, because you might not be able to copy and paste what is going on the other side, but you can look at the ecosystem that exists in the country for us to be able to achieve the same. Thank you.
Swali, hakuna?
What has been the impact of Marwa as you've been implementing it already? What has been the impact?
So when Marwa started, 12.5% of the Kisumu population was insured. After Marwa, we doubled that to 25%. Before Marwa, our facilities used to collect less than 50 million shillings a year in terms of health financing. After Marwa, our facilities are now doing 350 to 400 million shillings, meaning that there's more money available for health. Before Marwa, we used to see approximately 800,000 people in outpatient visits. But now we are seeing 1.2 million to 1.3 million people in outpatient visits, meaning that the numbers have gone up. There are people who wanted services but could not be able to access the services, but now they can be able to access those services. Of course, before Marwa, you could not hear a lot about digital transformation and the quality of health. We have now pushed our facilities into quality improvement programs, and this is a journey. You cannot reach the journey in one day. It takes years, probably 5 years for us to be able to reach. What we're trying to do in Kisumu was done by Rwanda in 10 years and Ghana in around 15 years. And Kisumu wants to do it in a record 6 years. Marwa has only been there for 1 year right now, and we've already seen that impact. Again, in terms of chronic illnesses, hypertension, diabetes, we are seeing 5 times the number of patients with hypertension and diabetes that we used to see before. Not to say that the cases are new, but to say that our systems are now able to detect them and you're able to bring them forth. And when you detect them, that means that you have to take care of them, and your cost of taking care of them goes up. So Marwa has already had an impact in our health system, and we want to use those lessons gained to be able to move forward. And finally, the lessons learned from Marwa have been shared nationally. Many counties have learned from what we are doing, and there is no need of innovating something from scratch. I saw recently health insurance being launched somewhere in central Kenya, and I'm happy that they consulted with us so that they don't go through what we went through, and they make the program better from where we were. So that is what Marwa has done for us.
Let me just make one point very clear. Marwa aims at covering indigents. Indigents means people who are not like you and I who have incomes. And there are quite a good number of such people who never accessed healthcare before, but now are capable of accessing healthcare, and we are aiming at covering more and more of them as the digital space discovers them and brings them in the network of Marwa.
Thank you for the question. Yes, I think we are still in the middle of this week. We started in Nairobi. What we did, besides making sure that also the Dutch companies, the Dutch organizations, the Dutch government and research institutes do have a good understanding about the health system in Kenya, the challenges, but also the opportunities. Also Dr. Ganda just mentioned. We did it in Nairobi, and we do that over here. Part of those understanding what's happening is also what we call matchmaking sessions, where we link those Dutch organizations, those Dutch private sector, to companies, to organizations, or to the government in Nairobi or here in Kisumu County, to see where they can find each other, to jointly work, co-create and work together on the solutions which are necessary to make. So yes, I see already some interesting links being made, some interesting contacts being made for follow-up, for investments, for collaboration in basically in innovation, in data, in digitalization, but also in equipment or in financing opportunities. So that will be worked out in the coming period. Thank you. My name is Joris van Bommel and I'm the Deputy Ambassador for the Netherlands to Kenya.
You better get the spelling correct, eh? don't write Yuri.
I give you one so you can.
So my name is Dr. Wasuna Owino. I'm the Country Director for Farm Access Foundation. And we do have a partnership arrangement with the county government of Kisumu and also the National Hospital Insurance Fund. And the main objective of our partnership with these three institutions is to be able to revolutionize the universal health coverage ecosystem. And how do we actually go about this? One is to provide financial protection so that each and everyone who is in need of health services gets it as and when needed. Currently, we have worked with these two partners to be able to provide access to 42,650 households, and this actually translates to 117,000 lives. Now, for this specific population, they do have access as and when they need in both public and private facilities. Now, this actually complements the national government's health insurance subsidy program, which also has a target in the county of 21,000. So what I would say, this is the only unique program that provides protection to those who are actually in need of help. And we actually go beyond just the provision of NHIF insurance subsidies, which is actually 6,000 per annum. We also look into the quality of services that is actually offered to this specific group. So in this case, we do have implement the safe care methodology to make sure that the facilities where this group goes to has access to quality care. And if you may know, Farm Access is also the one that provides technical support to the Aga Khan and Penda Health in terms of quality. So we would like to see that transition of the public health facilities having a similar quality of services. We also pay special attention to our mothers. And here we use an innovative value-based care model which is called mom care. And here is to make sure that we do have the mothers having safe pregnancy journeys so that we actually are able to reduce on the maternal morbidity and mortality. So those are some of the very, very critical innovations. Now we also have the Medical Credit Fund. Now the main objective of the Medical Credit Fund is to ensure that we actually intervene to make sure that those in the investment in the health, especially the small and medium enterprises, have got access to adequate funds which they can actually use for whenever they have liquidity issues. And this can actually go from 3,000 shillings to 50 million shillings. And bulk of it is actually is offered using the digital technology. Now, as we are trying to roll out the National Health Insurance Fund to the entire public, we are actually currently working with the National Health Insurance Fund to come up with a special product for the private sector and especially the informal sector to ensure that as many of them are actually enrolled into NHIF. Now this is a very special program that we are actually having with the county government of Kisumu, having moved from the indigent now to the medium scale enterprises. And we're actually starting with the fisher folk, sugarcane farmers, and also the rice farmers. So we find this to be very, very critical, and we're really very, very appreciative to the Dutch government for having provided that support that is actually enabling us to be able to turn around lives, in this specific county. And also a lot of credit goes to the governor for the stewardship and also for the entire leadership for us to be able to advance the universal health coverage agenda. Yeah, there are several ways to be able to join MARA. One, especially for the vulnerable, we need to identify you through a socio-economic mapping tool that really looks at, for example, your earnings, how many meals have you had either over the last X number of days, what type of house are you in, what type of water, do you really have all these services? So we do have a special poverty mapping tool, which is actually ingrained in our MTBA platform to be able to identify you as an indigent, the poor of the poorest, who would really need to have access to that specific service. Now, as an individual, we do have also a platform where you can actually go for self-registration to really get into MARA. As I did mention, we are now moving to the informal sector. Now, for the informal sector, we're actually coming up with specific strategies on how the informal sector can actually join. But in this case, we are not going to look at individuals. We are going to look at groups. So that if you come in as a group, we'd like the groups, structured groups, to be able to pool resources so that they are able to specifically join. But all these things we are talking about are actually all ingrained into the MTBA platform, where we do our specific registration. Now, we do have another group that I did mention earlier, and that's those who have been identified, again using our tool in the health insurance subsidy program that is directly provided by the government. So that group also stands to benefit. Now, as we go forward, we started with the indigent, then moving to the informal sector, then we'll now focus to the more wealthy population. And the objective of this is to be able to have that principle in insurance of cross-subsidization, so that the young subsidize the old, the sick subsidize, we have all these cross-subsidization from the different areas. Any other?
Hello, my name is Misha van Lin. I'm the director of the Task Force Healthcare, and I'm very fortunate to be the delegation leader of this health mission to Kenya this week. At the Task Force Healthcare, we really strive to improve healthcare together, and we do that by connecting the right people on a global scale. But we have been active in Kenya and East Africa already since 2015, engaging with local community, engaging with policymakers on the developments and the evolution in the health system as is needed. We have done that, for instance, by already organizing a number of these kind of visits in the past, before COVID, and maintaining the context and the relationships in a digital manner throughout COVID. So I think this exchange of information and exchange of knowledge and giving each other inspiration is really key in moving healthcare forward to all of us, for the people that need it most. In the Netherlands, we do that with what we call a Dutch diamond approach, and that is also really ingrained in the DNA of the Task Force Healthcare. And what does this mean? This means it's not only policymakers, it's not only researchers or knowledgeable people, it's not only enterprises or healthcare facilities, both public and private, working together, but we work together with NGOs, with civil society organizations, and most importantly with citizens. Yes, right, citizens, not only patients, because I think it's crucial that people take care of their health, have the ability to take care of their health before actually falling ill. So this visit to Nairobi earlier this week and to Kisumu here is not a first one. It's not a first after interaction between Kenya and the Netherlands, but it's one of the many steps that we will take together on a joint journey to improve healthcare. For interacting with the Kenyan healthcare system, it's crucial to understand the way that it has been structured with the various levels of hospitals, but also the way that public and private facilities cooperate, or where there's a possibility to strengthen this cooperation, all the way from community level to the high level 6 referral hospitals. So we had the opportunity to visit 2 private sector hospitals, one a level 3 and another level 4 hospital in Nairobi. Both excellent facilities, but both very different, with a different constitution, a different way of being organized, a different history, and both doing their utmost to give healthcare to those people within their communities that need it most. And I see a lot of opportunity for inspiration, for sharing information on innovations, on making sure that we get the adequate kind of funding, bringing in funding also from abroad and not only within the healthcare system as we have in Kenya. In Kisumu, we will visit a level 2 dispensary and a level 5 county referral hospital. So that really completes the picture also from the public side. And that is really key for us. It's not one institution that we want to collaborate with. It's not only community healthcare workers. But if you really want to improve healthcare across the board, you have to engage and interact across the board.
My Minister for Water and Environment and Fisheries, Salmon Orimba, and I followed just about a week after that, and we had a very good time in the Netherlands. We were very impressed by the manner in which you have managed your water resources. And we are determined to follow your footsteps, so thank you very much. My comments will be very brief this morning because I really liked what I had Greg presenting here, refreshing our knowledge about Kisumu. To tell you the truth, some of the things I didn't know. But one thing I know is that we have been both beneficiaries and initiators of the Lake Region Economic Bloc. For example, Zipline first came to us, and we realized that it would make a lot of sense if we did it in a larger scale within the Lake Region Economic Bloc. And indeed, we did go to Rwanda to see what the Rwandese do with Zipline. Zipline is there. And from there, we came back and implemented it immediately. So that's one of the outcomes of working together at the Lake Region Economic Bloc. So let me welcome you to Kisumu officially this morning. I'm sorry I came in the middle of all this, but I had another meeting with my security enforcement officers who are a little bit going astray. So I don't want them to not to perform their duties. So I had to go and talk to them before I came here. As we gather here today, this morning, we celebrate a partnership that has been fostered over time between the governments of Kisumu and the Netherlands. The Netherlands is bilaterally and multilaterally already a strong partner of Kenya and by extension of Kisumu County. We have a permanent ambassador here called Natalie, who we have insisted must be permanent, so that there's continuity in what she's doing. Kisumu, as you might already be aware, is growing to be a critical hub for trade and investment by its geopositioning as a gateway to the East African community, as Greg has just said. This is something which really is expanding as the maritime transport has just been revived in the lake, and some of the beneficiaries of that maritime transport are sitting here in this audience, the person of Professor Kamarogo there. He knows exactly what I'm talking about. And Kama, now you'll get a lot of attention. And maybe Villa del Sol will get the attention as well. So the East African region, as Greg has just mentioned, covers very rich countries, to tell you the truth. If you go to the Democratic Republic of the Congo, they say you can pick up gold on the leaf of a tree, but that has been picked up in a very haphazard manner, not the benefit of the Congolese, but the benefit of some very selfish and corrupt corporations across the world. We hope that the East African community will help the Congolese harness their resources for the purposes of developing our countries. So this engagement this morning is an ample opportunity for us to learn from each other, specifically in matters of healthcare and well-being. As a county, achievement of universal healthcare is a journey, not a destination. is the sum total of the deliberate efforts and steps taken towards ensuring every individual access to essential health services in a manner that does not cost them to spend a lot of money from their already limited resources they have. Now, before we came here, we were just having a small briefing in a room there, and I was being briefed by Natalie and her team. Who else was there? You were there too. And one of the things that we are asking is how much and how quickly Marwa, as a healthcare system, is going to cover all the indigents. And our ambition is that within the next 5 years, 75% of the indigents should be covered. And if possible, 100% after I leave being governor will be covered. And I hope that will be done. Kisumu started this journey in 2018 and has drawn a lot of lessons in the process. In this journey, we have also transitioned from an entirely analog system to a partially digital one, embracing the use of an end-to-end digital system in tracking the health commodity supply chain and the use of digital software in managing epidemics, and rolling out the use of emergency response system, which Greg presented very ably here. Presently, 70% of the community health volunteers, that's our 233 community units, are onboarded into an e-community health information system, an application that ensures that we have real-time data on the state of health of the community at any given time. Ladies and gentlemen, the county government of Kisumu recognizes and embraces the role of the strategic collaborations and partnerships that we already enjoy. Kisumu International Investment Conference that Greg referred to in December 2021 was a critical event, I think, that opened many doors since then. And I will not recount them here, all of them, but information is available online for those who want more information on that. This has led to the signing of a number of MOUs for innovative technologies, including the piloting of drone services for delivery of vaccines and blood products, provision of solar systems within a select number of our healthcare facilities, and implementation of electronic health management information systems in our county hospitals. We are currently negotiating with Philips to have a modernized mobile ultrasound technology for our pregnant mothers, enabling early diagnosis of life-threatening antenatal conditions. In conclusion, ladies and gentlemen, I wish to reiterate that Kisumu County will be taking a bold and participatory approach within the healthcare landscape. We remain committed to financial risk protection for all citizens and to health system strengthening through strategic partnerships, leadership, and governance, and continuous quality improvement. We will take incremental steps, step by step. We will learn from each other. Then we will celebrate our milestones together. I know that, for example, as Greg was telling you here, we have some very ambitious projects which we think would be very important in our healthcare delivery system. That is to improve the referral facilities in the county, beginning with the county hospitals here and Jaramogi Oginga Odinga Teaching and Referral Hospital. As you know, these hospitals were built at a time when the digital revolution had not taken place. So they are structurally quite often not geared toward receiving digital technology and digital transformation in the structural layup of these buildings. Now, having come from the Netherlands, and I see how modern architecture can help in using digital technology, we are challenged in Kisumu that we have hostels which at their time were the kind of the in thing, the thing of then, but now they are not the thing of now. So we have to know how to use what we have to adopt it to modern technology so that our patients and doctors and healthcare workers can have an environment that can work in very easily. I'll give you an example. If you go to a hospital where the first thing you encounter is a dark corridor, it gives you a very bad mentality. that you are entering a dangerous area, you know. But if you go to a hostel where light and green nature is what you are seeing, then I think you will already establish a positive attitude towards what is going to happen to you in that building. I went to St. Jude's Hospital in Memphis. It's a cancer hospital for children, which was established by some philanthropists after the Second World War who escaped from Europe and went to settle in Memphis. And at that point in time, cancer was a dreadful disease, and particularly if it called children, that is going to be worse. And that hospital was created really not just a hospital, but also a home for kids. It's about 9 or 12 floors high, and when you go to it, you find on every floor it's like if you are on the ground floor. So kids can play, can meet their parents, and can stay in the wards, can be treated without realizing that they're not at home. I was really impressed by that architecture and the environment of that hospital. Now, of course, we are very ambitious. We must, as I say, run while they walk, or leap into the future, as it were. That what we do today should stand the test of future generation. That we must build our society for our kids, not for ourselves. And I think that that is what Greg was talking about. I get very frustrated when I go to county hospital. I know that this hospital, a lot of our people are treated, but really we could do better than this. So I think that in this modernization mentality and mood that we are in, we shall do our best to improve our facilities, not just in terms of using the digital space, but also the architectural and physical space, so that we can make sure that the environment in which we provide health to our people is a friendly and human environment. Thank you so much.
Programs that we work with, like Farm Access and entrepreneurs and future collaboration in healthcare between Kenya and the Netherlands. Inspiring myself mainly the product development partnerships. Say a bit more about getting interactive connection with you, so really feel free to do so. Only on the 21st of October, so it's very hot off the press. And I really dare to say that Kenya is the first country between different people in the world that we want to address and we also feel responsible. Economics, that we're all interconnected, that health is not loose from economic developments, who sent a formal request to settle this global health. Living diseases both strikes to run. Secondly, which was definitely nobody is willing to take it, the missing point. I think we learn from you what are your key challenges and what can we do and what do we have to offer also by participants sector, civil society organizations, academic sector, other institutions, public sector of course, and also international organizations. Again, since we can only screen. And we really delved into the questions, what are the current challenges, focused on collaboration with the private sector, which I think was a nice contribution to the scheme. Two major interests, not only from our HR specialists, but also from economic specialists in countries as diverse as Brazil, India, Japan, Singapore. There's one key lesson that we learned, apart from the contents, is that there was so much expertise, and that is really something that's not only promising in the development of the strategy, but even more importantly in the implementation of the strategy. That definitely we can fuel, we can support, but the real work is being done by all the people who are working in the field. And that is, well, I think really something that we have to share and shout out. What other priorities did we include in the global health strategy? Based on all enables healthcare workers to see when someone presents, whether it be malaria or dengue or something else. It's not just one disease, but they are trained. We were appreciated for that for a long time, and there's a lot of expertise in the field and a lot of networks. Is the focus on these bodies are not ripe to give birth to children and lose their lives or their children's lives. Secondly, the focus on pandemic preparedness and response, which in the Netherlands is primarily led by the Ministry of Health. It's also important to state that, which is health system strengthening. I'll say more about that. The courage agenda, funding work that we're doing. And I think this picture really shows an individual
Across the private and the public sector. I talked about that in terms of, if you look at our family plan. If you look at the software, in terms of the health information platform, the governor decided that let us have an investors forum, and we did our first one in December 2021, which brought in local. We are very strong in community, and we are amongst the first counties. Now we need to improve on our county health management information system, which are very